Hi, this is Sean Kennedy. I'm the editor-in-chief of the American Journal of Nursing, or AJN. You're listening to a podcast in our Behind the Article series, which are interviews with authors of current AJN articles. You can find all of our podcasts on our website, ajnonline.com, under the Multimedia tab, as well as on iTunes, Spotify, and Google. AJN's content, including the article we refer to in this podcast, is accessible in print, online, on our website, ajnonline.com, or via the institutional Ovid database. You can also find AJN content on Facebook, Twitter, LinkedIn, Instagram, and our blog, AJN Off the Charts, on WordPress. Today, I'm delighted to be speaking once again with Dr. Bernadette Capili, who is director of the Heilbronn Family Center for Research Nursing at Rockefeller University in New York City. Candy, as she's known, is the author of an article in October issue, which is part of our ongoing series called Nursing Research Step by Step, which is being done in conjunction with the Heilbronn Family Center for Research Nursing. The column appears every other month in AJN. Today, we'll be discussing her article, Cross-Sectional Studies. This is the fifth article in the series, which is designed to give nurses the knowledge and skills they need to participate or understand research step by step. Each column presents a different research concept or method, from research design to data interpretation. And we found that this kind of taking small bites of research and presenting it this way is really helpful for nurses in practice who tend not to buy a big, heavy research book. That's fine when you're in a master's program or a PhD program, but we know nurses in practice, especially nowadays, are very busy. So this series is becoming very popular. So Candy, it's so nice to be chatting with you again.
Yeah, you too, Sean. Thanks for having me.
So this article, the prior column in the August issue was on selection and implementation of outcome measurements. And the focus there was on data collection using indirect methods like questionnaires. This column explains one type of observational research, the cross-sectional design. This seems to be used a lot in nursing studies, that at least in the ones we see submitted to AJN. Can you give us like a brief overview of what you include in this column about cross-sectional design studies?
Sure. So I do. I think this is a very popular design amongst, nursing research and other like behavioral kind of professions. For example, you get, an email to do a survey about, salary or potentially, how do you feel about, COVID? So that's kind of it's a snapshot. So this article talks about that, and it talks about, what are things that's included in a cross-sectional kind of study? What is it that you're trying to understand? You're trying to see, is there an association? Are there correlations between, for example, I think we look at obesity in HIV patients and sedentary behavior. It's one thing with a cross-sectional kind of study is it's important because you can look at like a prevalence. How many people are obese in a particular clinic setting? For example, in the article, we talk about HIV and the obesity in the clinical population. And then we also talk about a lot of times people are familiar with what's called a descriptive, like, okay, what percentage of people were obese in this clinic? What was like the mean age of the population? The percentage of, categories of ages, whether adult, teenagers, or children or whatnot. And then we also go on and go a little bit more advanced and talk about analytic type of cross-sectional studies, and where you're trying to look at, you're trying to understand a perspective or relationships in terms of predictor variables and outcomes. We talk about the odds ratios and confidence intervals, and we provide some examples and how to interpret it. I think that's really important because now it's not just really about the p-value, right? A lot of times people know the p-value. Oh, it's it's less than 0.05, then it's significant. A lot of times, if you read the journal articles, you do see that in addition to that confidence intervals, and sometimes it's just the confidence intervals that they're providing, and people may not understand what that actually means.
Yeah, I was really happy to see that this column talked about the confidence intervals as well as the risk ratios, because I think they are being reported more and more, even in consumer studies. healthcare journalists have really stepped up their game, I think, in terms of really trying to report not just what the soundbite is that gets carried on in the news media, but the Association of Healthcare Journalists has really made a big push in the last 10 years, I would say, to really do responsible scientific reporting. And so they are including risk ratios and confidence intervals, even for consumers. So I think it's even more important that nurses understand these to better understand what the study is actually saying.
Yeah, and I think what's nice about, again, the editors at AJN are always wonderful. When you write it, and then you have someone that the editorial office helps you, like, making sure the charts are there and the right figures are there. And so I think we do have in this article, so do take a look at it, because there are like little tables and boxes that people can look, and it's like a little cheat sheet. So it's kind of understanding, for example, confidence interval. So in terms of a take-home message. Mm-hmm. So if you see something that they give you, like I'm trying to find so I don't have to make up the numbers. For example, in the paper it says, for example, a 95% confidence interval. So you have a point estimate usually that says 2.4. And often there's a parentheses, right, that says like from right. 1.47 to 3. So what does that mean? It actually means that if you were to take another sample, it could range in those numbers. It could fall from as low as 1.47 to as high as 3.91. And I think what's also really important to understand is how wide is that? So if you right. have something, let's say that's from 1.5 to 20.5, it kind of gives you a little bit less confidence that it's a right. tight study or outcome. But when it's like a tighter kind of number, smaller range between, it's usually kind of a, maybe the results are a little bit stronger. But then again, it also depends on your sample size, right? The more participants you have in a study, the likelihood of it being more of a tighter or a more narrow confidence interval is probably going to be higher. Mm-hmm. I think another is really good to know about for nurses if you just wanted to do a quick snapshot is looking at, again, there were like a cheat sheet boxes in the October issue is in terms of interpreting the risk ratios or odds ratios. You look at the number one. So if it's like an odds ratio, if there's includes a number one in the result, if equals, it means the outcomes didn't really have any effect. But if the odds ratio or risk ratio is greater than 1, it means if there's some sort of exposure is associated with a higher odds of an outcome versus those who are not exposed. So like mm-hmm. if you're smoking, if you're exposed to smoking, there was a relationship. But if it's the odds ratio or risk ratio less than 1, exposure is associated with lower odds of that versus exposed group. So again, I think those are just the big things if you want to just get a quick snapshot is look at those. They give it to you. And I think that will be very helpful for the practicing clinician.
Yeah, I think the examples, and it's throughout the whole series, I think you and your colleagues who've been co-authoring some of the pieces have really done a great job of providing specific examples that really cement the concepts in reality so people really can understand them better. And I think that's a strong point, a real strong point of the series.
Yeah, I think that was one of the things. I think as someone that is a life of myself, as I consider myself a forever student, a lifetime student, always learning, is sometimes I look at different textbooks and I see, and especially now I think with nurses, and it's great, everything is evidence-based practice, but a lot of times it's very, they talk about the lit searches, they talk about, the level of the evidence, which is all really important, but it's nice to have understanding of it more than just the definitions of what does that mean. It's nice to actually see it kind of like laid out, and you can try to plug in the numbers, and if you want to try to calculate it, you can. Yeah,
that's good. So just in winding up, in thinking about cross-sectional design studies, what's like the main point you think nurses need to keep in mind if somebody, they pick up a study that they received from one of their lit searches, and of course the first thing in the introduction might say that this is a cross-sectional design study. So what's the first thing that you would think nurses should keep in their heads when they see that?
Well, first of all, it's there's no intervention, and it's usually like a snapshot. Usually it's a one-time kind of survey done. And in terms of, remember, evidence-based practice is kind of on the lower level of evidence because again, when you're doing an interview or you have someone do a survey, maybe especially if it's about like diet, for example, it's a recall, and people
Right.
may not remember. So last week or last month, how many times a month or a day, whatever, do you drink milk or do you eat carrots or something like that? So it may not be as, precise of a measure, unlike if you're actually having someone where, like, for example, actually writing it in that day they're eating or taking pictures of their food perhaps that they're eating. So that would actually be more accurate. So I think that's kind of the caveat of that. I mean, it's cheap to do. And it's something I know, like a lot of early, people starting out, it's one of the first kind of studies people often do. And I think also don't forget, it's not just about like a paper and pencil. People can also not only do a paper and pencil with a cross section, but people can also do measurements. They can do blood pressures, they may do like, sort of DNA swabs. So things like that. It's not just about the paper and pencil. And sometimes I think that's what people kind of just associate it with it. But there's also other physiologic markers people can add to their, paper and pencil kind of survey for participants.
So, well, that's great information. And as always, I love talking to you about research because your passion for it comes through so clearly.
So thank you so much.
Thank you, Candy.
Sure, thank you. I'll talk to you again.
Yes, I look forward to the next time. Thanks again.
Okay. You're welcome. Bye-bye.